All right, yeah, welcome back again. So we just want to look at the result, performance result and discussion of our machine learning algorithms that we modeled for our two diseases that we just computed. So we want to interpret the result. As you can see on the screen here, looking at this result critically, there are many things you can infer from this result. Uh, let's try and break it down from the sort of a view. I'll just explain them briefly. So, looking at the table, we can do a proper analysis of this result, and we can explain them. That will be our interpretation, and we look at the result comparative analysis. I will discuss it briefly, and I will conclude. So, just follow, and as we go into that, uh, look at the table actually summarizes the performance of the three machine learning algorithms. All right, we have the support vector machine, we have random forest, we have neural network in binary classification of fragile X syndrome and Williams Buren syndrome based on the selected 32 anatomical facial landmarks. Okay, so these extracted facial landmarks resulted in 11 in 60 pieces, actually 60 pieces, all right, using a 95% confidence interval, in which we use as features for classification. All right, the performance metrics provided include sensitivity, specificity, or precision, F1 score, and accuracy. All right, and then looking at the table, we understand that the algorithm, the SVM algorithm, demonstrates a high sensitivity of 0.0888. All right, yes, indicating that it is very effective in identifying true positives, that is, correctly identifying cases of fragile X syndrome. However, the specificity is slightly lower at 0.777. You can see that, suggesting some false positives. That is, instances where Williams-Buren syndrome is incorrectly identified as fragile X syndrome. Okay, now with a precision of 0.8, SVM maintains a good balance between sensitivity and specificity, resulting in an F1 score of 0.8421. All right, is that correct? Yes, 0.8421, and an overall accuracy of 0.8333. All right, so now for random forest, it shows a perfect sensitivity of 1. All right, meaning it correctly identifies all cases of Williams-Buren without any false positives. Its precision is also perfect at 1. However, its sensitivity is lower at 0.7222, indicating that it misses some true positives. That is, some cases where cases of fragile X syndrome are not detected at all. Despite the lower sensitivity, the high specificity precision of precision lead to a strong F1 score of 0.837 and accuracy of 0.8611. Right? When you go down to ANN, neural network, it presents a sensitivity of 0.7, which is low, which is the lowest among the three algorithms, indicating that it misses the more true positives compared to SVM and random forest. However, it compensates with a high specificity of 0.9444 and a precision of 0.9333, showing that it has fewer false positives. The resulting F1 score is 0.8 and the overall accuracy is 0.8157. All right, so this is just a result overview. Now I'm just giving us an overview from this table. All right. Now we can do a comparative analysis. Now let's compare. Okay, looking at this table critically now, we're trying to compare now, because sensitivity aspect, or we call it the call. Sometimes it has SVM has the highest ability to correctly identify the true positive cases. All right. Okay. Specificity aspect, random forest perfectly identify true negatives, avoiding false positive entirely. And precision, in precision, the random forest and neural network are more precise in their prediction compared to SVM. In F1 score, SVM has a slightly higher F1 score, indicating a better balance between precision and the core. And accuracy, random forest has the highest overall accuracy, followed closely by SVM and then neural network. Now, these results highlight the trade-offs between sensitivity, specificity, precision, and overall accuracy among the three algorithms. Okay, SVM is the most sensitive, making it the best choice when the primary goal is to minimize the false negatives. That is to say, ensuring that Fragile X syndrome cases are not missed. Okay, however, it is less specific than random forest and neural network, which may lead to more false positives. Meanwhile, random forest excels in specificity and precision, making it highly reliable in correctly identifying true negatives and ensuring no false positives at all. This makes it suitable for scenarios where false positives are particularly problematic. Its high accuracy also suggests a good overall performance despite the lower sensitivity. Okay, so that is just looking at a discussion now. Whereas you can say neural network shows a balanced performance with high sensitivity, and precision, though it has the lowest sensitivity. This makes it less suitable for applications where detecting every positive cases is critical, but useful when avoiding false positives is essential. All right, so we can conclude now on this particular matter. We can conclude and recommend. Okay, looking at this result now, given these considerations, practitioners should select the algorithm based on the relative importance of sensitivity versus specificity in their specific use case for clinical scenarios where missing a diagnosis could have significant consequences. SVM's higher sensitivity might be preferred. However, in cases where false positives could lead to unnecessary treatment or anxiety, random forest perfect sensitivity would be more appropriate. Okay, the neural network can serve as a middle ground with strong overall performance, but might not be the best for extreme sensitivity or specificity needs. Furthermore, this comparative analysis underscores the importance of aligning the choice of making machine learning algorithm with the specific goals and constraints of the application, ensuring that the strength and the chosen model align with the critical requirements of the task at hand. All right. Ultimately, the choice of algorithm should be guided by the specific needs of the classification task, balancing the importance of sensitivity, specificity, and overall accuracy. In clinical context, the cost of false positives and false negatives will heavily influence the decision. All right. So we just try to conclude there in that form. So you can further go and showcase the scatter plot of the hyperplane of SVM, how it is able to separate the disease into two. You can see the factors aligning on the plane on the line. So we can see that there is a separation, and the boundary was clearly separated. So this is a good result for SVM actually. even though it doesn't give us the highest like a random forest. All right, so we can go further and compare our results we got here now with other um, uh, maybe articles online in this field. You can compare further if there's any need for benchmarking. You can do that. Okay, look at what other researchers has done in this field. Try to compare your work with their works. Then try to make some inferences. Then and cite the work and compare. So that's all for that under this case. So we will proceed next time to look at other results that we have achieved so far. Thank you so much. I will see you in the next class. Meanwhile, lest I forget, don't forget to include the confusion matrix. I escaped that, so that was skipped. Don't forget to include it for the performance and briefly discuss it for each of the uh, machine learning algorithm we use. So that one is simple enough, which I have explained in before in the slide. So you can just bring the knowledge into it and explain it briefly. Thank you so much. All right.